members of the SC United for Justice and Equality Coalition here in South Carolina. I'm just going to give you just a quick sort of overview. I know many of you are very familiar with the bill already, so we won't belabor the points, but just want to make sure we're all starting from the same sort of level of understanding here. So H 4624, and you can see this on your screen as well, bans gender affirming care for anyone that's under the age of 18. And this would, so I'm going to stop looking at the slide because that throws me off. But it bans gender affirming care for anyone under the age of 18. This includes puberty blockers, gender affirming hormone therapy, and surgery. This would allow for folks who are already receiving treatment to have what would be referred to as a sort of a weaning off period, which we understand is problematic, but they would be allowed to remain on their medication or continue to receive treatment, but they would have to cease that treatment entirely by January 31st of 2025. If the bill is signed into law for anyone else who's wanting to start care, it takes effect immediately as soon as the governor signs the bill into law. There's also provisions within this bill that encourages school personnel to out youth who they suspect are transgender to their parents, which is, of course, extremely problematic in that it could cause extreme harm for some folks who are not ready to come out yet. There's also the public funding provisions within this bill that would restrict care that would be funded through public funding like PIBA, the state health plan, or Medicaid, and would make it so that those policies would not be able to provide coverage for gender affirming care. And that is for all ages, not just minors, but anyone of any age. Additionally, there's wording in this bill that would restrict healthcare providers who receive public funds from providing gender affirming care to trans folks. Again, this is restrictions. There's no age limit to this restriction, and this is up to the interpretation of these providers and how they want to interpret this bill, whether or not they can continue to provide this care for adults. That's the general sort of overview of kind of what is included in the bill. As far as sort of where we are currently, as Ivy said, we're currently waiting on the House to take the bill up, and they will then vote on if it is taken up by tomorrow at 5 p.m. They will vote to either concur or non-concur on the bill. If they vote to concur, then that means they're saying that this version of the bill was passed in the Senate, they agree with. It will then immediately go to the governor's desk. If they vote to not concur on the version that was passed by the Senate, it then goes to a conference committee that is made up of members of both the House and the Senate who will discuss what they want kept in the bill and what they don't want kept in the bill. And then that would, if they were able to concur there in that committee, they would then go to the governor's desk. If the bill is not taken up by the House by 5 p.m. tomorrow when they adjourn, then the bill dies. But we're going to remain very realistic about what we're looking at here and the likelihood that it will be taken up by the House here today or tomorrow before they adjourn. But that's kind of where we are currently. And of course, if you have any questions, we can do our best to answer those in the chat. But again, this is really just moment by moment, watching what the House is getting ready to do here if they are going to take it up this afternoon. But that's our current status.
Thank you so much for that overview, Chase. In this, I also just want to take a second to recognize all of the work that so many folks who are on this call, people in our community have done to fight this off as long as we have. They started with subcommittee hearings trying to pass this. We were just talking about, they tried all last year too, but they started with subcommittee hearings on this before session even started. And here we are with just like a day and a half left. of the legislative session in South Carolina. So that we're even in this moment speaks tremendous volumes about the incredible work that so many of you who are on the call have done to help fight back against this. But we, remain hopeful, but also this is a really heavy moment that could really dramatically impact a lot of folks. So wanted to, make sure that we're getting as much information out about this as quickly as possible for folks too. And Jason, I saw that you just joined. Is it okay if we throw the ball over to you for a little legal analysis around the bill?
Sure. Hello, everyone. Jason Starr, he and him pronouns, litigation strategist at the Human Rights Campaign. Really grateful to be connected with you all here. Because we have some experience with our movement partners at litigating these bills, but also because I grew up in Rock Hill, South Carolina, and although I live in New York now, my family's still there, and I'm there very frequently. So it's wonderful to meet folks like yourself who are doing work in the state. So thank you. So maybe I'll just give like some broad context to the 2 points here, and then I'm happy to like answer questions about the bill or the issues that the bill raises, legal issues that the bill raises. As you all know, these bans have proliferated over the last 3 legislative sessions, starting in Arkansas back in 2019. We at the Human Rights Campaign cover cases challenging bans in Florida, which we've actually recently had a full trial on this past December, Alabama, which is up on appeal from a preliminary injunction, and Georgia, Alabama, and Florida. As you know, the Supreme Court is likely to address the issue potentially even as early as the next session. There are 2 cases sitting up right now, as you know, seeking certiorari review, and I think that it's likely that the court will take one or both and have something to say on this issue. At least that's the working thinking. We have been really successful at getting preliminary injunctions at the trial court level. I'm trying to go through the Rolodex, and I think we probably have won every one. The broader movement, I should say. It's in the circuit courts that we are finding a lot of difficulty. So at least a few circuit courts have overturned district court bans, overturned district court injunctions that allow care to continue to happen. And as you all know, the landscape is really contracting across the country in terms of the number of providers and the availability to both initiate care and for people even to continue care. Florida was the first state that we saw to introduce restrictions on adults regarding the type of provider that could prescribe, and also a lot of other things around informed consent and the like that make it difficult to near impossible for adults in Florida to start care again, continue care in the state. So I read the South Carolina bill as placing, complete ban on the care for minors, also requiring, I'll use the term sort of detransition care for, or detransitioning for minors who are already receiving care. And then, of course, some of the funding restrictions on the all care, including adult care. And I know that there's the outing provisions as well, but we're focused on the healthcare pieces. The Fourth Circuit, the Cato case that came out last week before last, the Fourth Circuit is holding strong on so many issues of our issues. So there is some good circuit precedent there. I do think it's somewhat measured because I think that folks understand the Supreme Court is interested and will ultimately set the national context for for whether states can introduce these kinds of bans or restrictions. So I'll stop there. Like I said, happy to answer questions or just be available, even if things come up after today.
Thank you so much for that, Jason. That's so helpful. I know so many folks have lots of questions about what all this stuff means right now. And I would love to throw the ball over to my coworker, Carolyn, who runs our Southern Trans Youth Emergency Project, to tell us a little bit about the resources, some of the resources that will be available here in South Carolina.
Thanks so much, Ivy. As I said, my name is Carolyn Jones. I use she, her pronouns, and I am the program manager for the Southern Trans Youth Emergency Project. This is a project that is put in place to support families of trans youth all across the country who are impacted by bans and restrictions on gender-affirming care. And we're ready and able to help South Carolina families immediately in order to figure out the best next steps for you and your family. As was mentioned earlier, the youth components of this bill include a ban on gender-affirming care that includes puberty blockers and hormones and surgery for anyone under 18, with the inclusion of that provision that allows for, and I say allow in sort of the broadest term because this is of course horrible, but a period until January 2025 for youth to quote unquote wean off their care. Every provider is going to interpret that piece of the provision differently. So we'll work to help you figure out how your provider is interpreting it and figure out the best way for you to continue care for your child. So with the Southern Trans Youth Emergency Project, you can reach out to us for a few different pieces. The first one is patient navigation, as I mentioned, just to understand your options for continuing care. In a lot of cases, this will look like continuing care in out-of-state providers. And we'll help you figure out the best provider for your family. Everyone's situation is a little bit different, but we'll nail down what works the best for you all. We can also offer grants of $500 every 6 months to the families of trans youth to support immediate needs, which includes travel expenses, mental health needs, anything that your family needs to get through this time, and to make sure that you have that bridge to continued care. These grants of $500 are exclusively for the families of trans youth. And again, reach out to have that one-on-one conversation so we can figure out the best next steps for your family. Katie, if you could go to the next slide, that would be great. The options surrounding South Carolina right now, just so everyone is aware, is that puberty blockers remain legal in Georgia. So if your child is at a place where they need puberty blockers, we can help you find a provider in Georgia to offer that care. Unfortunately, HRT is not offered in Georgia for folks under the age of 18 at this moment. So we'll help figure out another option if you're at that stage and figuring out that part of your medical care. In North Carolina, there's also a unique situation. So if you were able to start care before August of last year, 2023, even if you started that care in South Carolina, there are providers in North Carolina that would be able to take y'all on. So again, I threw a lot of information at you, but the important thing to know is that there are options, there are bridges to continued care, and we're here to help y'all figure out what those bridges are and what they look like, as well as figure out what to do immediately. For immediate next steps, it's really important to reach out to your current provider to figure out how they're interpreting that piece, that provision that would allow care until January. Again, if they're not, we'll help you figure out another option. Also immediately reach out to us to have that one-on-one conversation one way or the other. If your child has not yet started gender-affirming care in South Carolina, it is also a great idea to reach out to us as soon as possible so we can see what's possible, and if there is a way to get your child into care before everything goes into effect. But it is likely that you'll need to initiate care out of state. When it comes to the adult provisions of this law, we're also here to help figure out next steps in that piece. As mentioned, the adult components of the bill say that providers that receive public funding will no longer be able to provide gender-affirming care, and that folks that are on Medicaid or a state employee healthcare plan will no longer be able to use their plan on gender-affirming care. We're also here to help support folks in figuring out next steps if you're impacted by the adult provisions of this law, reach out to the link that Adam will throw in the chat, and we'll have a conversation with you as well and figure out what makes the most sense for you. We're exploring every avenue for how to mitigate the harm of this bill, and this intake form that we'll share is a great place for you to share your story, how you're impacted by this bill, so we can best understand the impact of this and figure out next steps. So if you're a trans adult in South Carolina above 18, reach out to your current provider to see if there will be any interruption in care and seek support from us, and as well as referring any instances of denials or delays in care to us as well. One thing that I think is really, really important to note for both adults and youth is that there is no impact on mental health care in these bills. Youth are able to receive mental health care as well as adults, but youth are able to receive mental health care as they were before. There's also no restrictions on traveling across state lines to receive gender-affirming care. So again, we'll help you all figure out next steps. If you're impacted by this bill, reach out to us as soon as you can, and we're alongside this fight with y'all as we figure this out. Happy to answer questions at the end. At this point, I will hand things over to my colleague, Craig White, to talk a little bit about the anti-trans school components of these bills.
Carolyn, thank you so much. My name is Craig White. I use he and they pronouns. I'm the supportive schools coordinator for the Campaign for Southern Equality. I live in North Carolina, very frustrated to see what the South Carolina legislature has been doing, and so pleased and proud with what all the advocates and South Carolina citizens have been doing to fight against these bad bills. It's been one of the best fights that we've seen in any state in the United States. So well done, South Carolina. It's a little bit hard to talk about the language when we don't know exactly what is going to be approved by the legislature, but I'm looking at the version of the bill that was approved by the Senate right now. What we see here in terms of schools is what's often referred to as harassment legislation. It is not very clear how it is supposed to be implemented. It's not clear at all how it's supposed to be enforced, but there's just a few lines in the law that really empower and encourage schools, school administrators, and educators who want to discriminate against trans and non-binary people. It really provides some permission for them, some allowance for them to do that. This particular provision is a mandatory outing provision. It is not exactly clear what it would require teachers and schools to do, but it indicates that teachers would not be allowed to use a student's affirmed pronouns if they're different than the pronouns that they were assigned at birth without the parents or legal guardians being notified first. There are some other pieces that are a little bit more vague, and we're going to have to look at how this is implemented. The thing that we wanted to bring to your attention today is folks have already mentioned the possibility of challenging unjust laws like this through lawsuits and litigation. There is also a path for challenging unjust state laws through civil rights complaints. It's important to recognize that at this point in education, in housing, in healthcare, and in several other areas, federal law that prohibits discrimination on the basis of sex also prohibits discrimination on the basis of sexual orientation, gender identity, and gender expression. So if a school is discriminating against a transgender or non-binary student because they are transgender or non-binary, they are breaking federal law. And because the US Constitution sets federal law higher than state law, it doesn't matter what South Carolina permits them to do, they're still violating federal law. And so if you experience this discrimination, or if your child or student experiences this discrimination, you have the option of filing what's called a federal civil rights complaint. In this case, it would be a violation of Title IX, which prohibits discrimination in schools. Filing that with the Office of Civil Rights at the U.S. Department of Education to say we're experiencing this discrimination. You do not need to be a lawyer. You do not need to have a lawyer. All you need to be able to do is to fill out an online form. It takes an hour or less. And then the Office of Civil Rights will have the attorneys that then investigate that complaint and issue remedies or recommendations for addressing that. If that is a step that anybody's interested in taking, we're more than happy to support either individual families or community organizations with filing those complaints. It's hard to see from the legislation itself, because it is so vague, whether we could challenge the legislation through a civil rights complaint. But as the legislation is implemented in schools, if that contributes to what's called a hostile educational environment in the school for trans and other LGBTQ students, then there's grounds for filing a complaint. Again, I'm happy to take questions around this, and we're happy to support in the process.
Thank you so much, Craig. It is really an especially vile thing to add into this bill. So really appreciate your resources there, and I'm sure folks will have questions about that. At CSE, you know, we're happy to take the lead on helping with the navigation pieces of this and providing grants to families, but we also partner with folks on the ground in the states that we work with, and have some just truly incredible partners who work every single day and have been for years on the ground supporting trans and queer youth across the state of South Carolina. And I'm so excited to give them some time to talk about the just truly incredible work that they do and some of the resources that they provide for folks in our state. So first up, would love to throw things over to, I think, Dom or somebody from the We Are Family team to share some about the amazing work y'all are doing.
Sounds great. I could take it from here. My goodness, Domenico here with We Are Family, they, he, and the last time we had one of these town halls, we were able to uplift one of our programs. It was our Queer Youth Prom. I'm going to drop a couple of links in the chat right now. And so I just wanted to quickly sort of close the loop on that. We had our Queer Youth Prom a couple of weeks ago, and for sort of, you know, for your daily dose of, you know, queer and trans youth joy, please take a look at some of the photos there. These are sort of vetted photos. We had nearly 200 youth come to this event, and it was fabulous. One of the folks who were there is sort of I saw on here sort of Kendra, and so I wanted to sort of uplift that. Kendra runs the Queer and Trans summer camp in the Charleston area. So Kendra, if you're able to, you know, drop your contact in that website in the chat, that would be great. There are scholarship opportunities for any youth who want to take part in some day camps throughout the summer. The one program that I did want to uplift is our mental health assistance program. I have that linked there in the chat. This is one of our programs that we are officially going to be, we've been doing it unintentionally, sort of because we don't say no to any youth in South Carolina, but we are officially having this to be scaled statewide, which is really exciting. This program provides free one-on-one therapy for youth up to the age of 24, queer and trans youth up to the age of 24. We partner with, we have a network of 21 affirming therapists who have been vetted and trained by our youth in the Queer Youth Approval Board. And so on that link, there's an application there. So if you know of any youth and young people who could use free therapy, please feel free to send them this information, as well as fill out that application there. And the last thing is additionally, last thing in this coming year, we will also host statewide virtual therapeutic groups. Statewide virtual therapeutic groups. Yeah. So that'll be coming out. Thank you.
Oh my gosh. Thank you so much, Dom, and the whole We Are Family team. Y'all just do such incredible work, and it is such a joy to get to share space with y'all. And I just really, you know, can't thank you enough for all that y'all do. We have another really incredible organization with us. I would love to throw the ball over to Raymond, who's also been part of our rapid response team this season, really being on the ground, trying to fight back against this bill, and then also heading up the Uplift Outreach Center, which has been an amazing resource for a lot of youth in our community. So I'll stop talking now. And Raymond, would love to throw the ball over to you.
Awesome. Thank you so much, Ivy. Hi, everyone. Raymond Velasquez, he, him pronouns, Executive Director for Uplift Outreach Center. We're located in Spartanburg, but we serve youth across the upstate region. I want to drop our website in the chat too, if you may not be familiar. I do see the co-founder, Deb Foreman's on here too, and some of the board members. Hey, y'all, I see you. But thank you to everyone for holding this space. Uplift Outreach Center, we're committed to providing like a safe and inclusive space for LGBTQ plus youth in the upstate South Carolina. Some of our goals for for our program is like providing that safe space, supportive services, empowerment, and community engagement. We also have a great a mental health program. Currently, it's for Spartanburg County, but we are looking for ways for growing that program as that program itself has grown in the past year or so. So we're really trying to figure out ways to kind of grow that program as far as like not being so region specific and in navigating grants and all those fun things. But yes, I think Uplift, we've been as far as like our youth and our impact, we're very intentional on broadcasting messages of hope and continuing the work and the events that we have planned and lined up, such as our Rainbow Ball, which is next weekend. But we're just very intentional that we need to broadcasting our message of hope, and also at the same time being like transparent as well that this is going on, but we're also not alone in providing that support services. We also have like a monitored Discord channel that connects all of our youth together. If some of the youth are across South Carolina as well, but providing those spaces for support and venting and conversation, and most importantly, community. We're also in the process of working with like other community orgs or other CBOs in the upstate area, such as our friends at Queer Wellness Center and in the PFLAG groups for the upstate as well. Trying to come up ways for the importance of establishing ways for continuance or continuity of care. So we're working very hard and vigilant for our youth, but also continue to providing the safer space and the programming and everything that we stand for. So again, thank you so much for everyone. The link for our the link for our website is in the chat as well. So please check us out. Contact information is on our website as well. So please feel free to reach out to me at any time. Thank you.
Thank you so much, Raymond. And thank you to the whole Uplift Outreach team. I know y'all do so much to support our youth in South Carolina and especially in the upstate. And I just really can't thank you enough for all you do. I think I see Christina is on with us, and we have another, last but certainly not least, partner organization. Would love to lift up some of the work that the Harriet Hancock Center is doing. If I could throw the ball to you for a minute, Christina.
Oh boy. Hi, everybody. It's been a long day, so I'm just gonna keep my camera off. Oh my gosh. We have so much stuff happening at the HHC. I would say this weekend we have All Kinds of Families Day, which is our version of an alternative Parents Day or Caregiver Day. We acknowledge that for some folks, Mother's Day is not the happy holiday that it is for some, and so we want to just be able to create space and community for those that might need it. So this weekend we are doing a walk in the morning that I'm actually leading down at Columbia's Canal and Riverwalk Park from 9 to 10, and then we're actually going to do something at the center in the afternoon, and it looks kind of like a crafting afternoon, and there's some cookie decorating as well. We have our Queer Closet pop-up next weekend, which is Friday, Saturday, and Sunday. We have received a ridiculous amount of donations, and it's so exciting to see, one, all the clothes that everybody wears in the area, but two, just to kind of see the outpouring support from everybody too. This closet is for everybody and anybody who might need it. So we've had folks ask if this is for our queer prom, which we're hosting in June. We've had folks say, is this only, for trans individuals? And our answer is it's for everybody. We also acknowledge that for some folks, as they are trying to, I think find themselves and be more authentically themselves and comfortable, changing your closet can get really expensive. And so we just wanted to be able to provide that opportunity for anyone. Also recognizing that, folks need dress clothes for job interviews and job transitions and all sorts of things too. So we just wanted to make sure we had a variety of stuff for folks. And then, like I said, we're hosting Queer Prom in June. I think this is the first one that we've hosted in the Midlands in 5 or 6 years. And I'm really excited about it. Our registration just got finalized yesterday, and we're starting to do all of our outreach. And I know schools are going to be done in a few weeks as well, but we have a huge outreach plan, I think. Our date is Friday, June 14th. In a perfect world, I would have 250 kids there, but I know that is like the stretch. But it's going to be at Historic Columbia. We are doing a 1980s murder mystery prom. That is what some of the feedback we got from some of the youth that we work with directly asked for. So think like Miami Vice, very bright colors. We're going to have drag performers. There's going to be some really good food and a really good DJ. So there's a whole lot more. I would say check out our website. We have revamped our website, and we're continuing to do some updates, but our community calendar is updated with all of our stuff. We also were able to get all of the pride parades and festivals around the region on that calendar as well. And we're really aiming that as folks have events happening at their organizations, that if they can inform us of that, we can get that on our calendar too. We are in the Midlands, but the Midlands is 11 counties, and that's really spread out. And from the data we've been collecting, we can actually see we have folks from both the upstate and the low country that actually come to certain events at our space pretty regularly. And so we're wanting to make sure that we are uplifting as many organizations as possible and just letting people know what things are existing so that they are able to find their community wherever they think they need to find that.
Oh my gosh. What amazing programs. And I feel like I'm gonna have to figure out a way to be at that prom. That seems like something that I really need in my life.
We may need some chaperones. So
Okay.
Ivy, if you want a chaperone, hit me up.
I'll be on the lookout for sure. What a great reminder for folks who are on the call of just how many resources are available and how much love and support you have across the state of South Carolina. And I hate to bring us back down a notch. I wish that we had ended on that note, but do think it's important for us to take a minute to hear from a provider to share a little bit of their information from a provider's perspective. So Natalie, are you available? Could we throw things over to you for a minute?
Yeah, absolutely. So I'm Natalie Frazier. I'm a certified nurse midwife, and I'm the director of Planned Parenthood South Atlantic's gender-affirming care program. Excuse me. So Planned Parenthood provides gender-affirming care across South Carolina, North Carolina, Virginia, and West Virginia to young people and to adults. And we've dealt with bans on care in North Carolina and West Virginia. So I'm sad and disappointed that we're doing it again in South Carolina, but we're here to provide care no matter what. And we just know that this is just such an unfair burden, and we want to do whatever we can to make it easier for anybody that's affected. As far as Planned Parenthood South Atlantic goes, we're going to continue to provide care as long as it's allowable under the law. We're accepting new patients now, and we'll continue to do that as long as we can. We will provide gender affirming care to patients under 18 in South Carolina as long as we can. And then we're not making any changes to the care we provide to adults in South Carolina once this law is passed. So none of the other provisions are going to impact the care for adults at Planned Parenthood. We do have health centers in North Carolina. So if someone has to transition out of South Carolina, if you started your care prior to August 1st, 2023, then we would be able to see you in North Carolina. Otherwise, we'll be able to navigate patients to our health centers in Virginia, which is obviously not like a great convenient option, but I think at this point in the Southeast, Virginia ends up being the closest place you can go. So I'm glad we have health centers here that we can easily get people care. And so, we do have gender affirming care navigation. We've got help for people to figure out, the best options for them. So if you need help figuring anything out, you can give us a call. I'm going to put our info in the chat so that you've got our number and everything. And I'm happy to answer any questions.
Thank you so much, Natalie. At this time, we are going to stop the recording.